Good evening, Saint Lucia, and welcome to this special feature on our island's healthcare system, featuring Prime Minister and Minister for Finance, Honourable Allen Chastanet, Minister for Health and Wellness, Honourable Mary Isaac, and Minister for Economic Development, Honourable Guy Joseph. This evening, we will present to the public the government's plans for the healthcare system and our plans to address the pertinent matters. When this administration campaigned, among the mantras related to healthcare was providing affordable, quality healthcare for the people of Saint Lucia. As we begin, we first turn to the Honourable Prime Minister to take us through the government's vision for healthcare. Honourable Prime Minister.
Thank you very much. Fellow Saint Lucians, when we campaigned, and even prior to campaigning, and putting together our party's position on healthcare, we clearly understood some fundamental issues. One was that we had not lived up to the expectation by any party to provide quality healthcare for Saint Lucians. We were living the dream of trying to attempt to have universal healthcare, but we all have to admit that we are far away from that, because universal healthcare would mean that we would be providing access to healthcare to all Saint Lucians. And when we looked at the system that we had, we were not fulfilling that. We had a new hospital coming in, the OKEU hospital, as well as the possibility of another hospital being built in the south end of the island, which is the St. Jude's. And the plans were to broaden or widen the scope of work that was going to be done or provided at St. Jude's. The former government clearly was struggling, despite the fact that works had already commenced on OKEU and could have potentially been opened substantially earlier. That did not happen. So for the entire 5 years, it remained in a construction phase. The decision to broaden the scope of services in the south was also changed. So the initial policy was under Stephenson King, the Honourable Stephenson King, was to really fix up the existing structure at St. Jude's, be able to move the staff who are at George Odlum Stadium back to the new facility in St. Jude's as quickly as possible. And at that point, then look at the possibility of building a new hospital facility in the south in a different location. In fact, there were 3 different locations that were identified for that possibility. But even St. Jude's was not completed, as the former government chose to go away from that strategy and basically agree to build a larger facility, but on the existing site. So the construction work and the scope of work was broadened significantly, and in the 5-year term, they were not able to complete the St. Jude Hospital. In fact, according to a document that was put out by, or a letter that was written to the then Minister of Finance and Economic, was to say that the project was now further delayed, and that instead of it opening up in the summer of 2016, that they projected it would open up in December of 2016, but at an additional cost. So the new cost was approximately $160 million it would take to be able to complete the St. Jude's project. And this is a project that started off as a budget of almost $36 million. So the dilemma that we also faced, despite not being able to afford quality standards in our normal day business of providing those services, we now had to look at opening these new facilities. The University of West Indies put out a study which said that to operationalize OKEU would cost approximately $70 million. So currently the government spends $110 million on its budget for healthcare. So it's a significant increase in our cost. And this is a time when government has continued to run budget deficits, meaning that we are spending more money than we were earning. the expectation was that we would close down Victoria Hospital as a hospital and only maintain it as a polyclinic. We spend about $35 million a year on Victoria Hospital, so the expectation was that at least we would save $20 million, which would offset part of the $70 million, so it means that we were still short of $50 million in order to be able to operate the facility. And clearly there would be additional expenses once St. Jude became operational that would also add to the operating cost of healthcare in St. Lucia. When we came in, there was no decision that was made as to how this was going to be financed. In fact, the only decision that had been made was to statutize the OKU. So a bill came to the House while we were in opposition to make OKU into the Millennium Heights. So that basically, like St. Jude, the OKU would have its own board, which would be called Millennium Heights. And therefore, all the staff and everybody who were hired to work at OKU would be part of that entity. So they no longer would be on the payroll of government, but they would be on the payroll of Millennium Heights. We reviewed that decision and we concurred. We think that that was a good decision to statutize the OKU. The next thing was, how were we going to finance it? So there was no concrete decisions that had been made as to how we were going to finance the new OKU, which was about $50 million of additional expenses, nor how we were going to fund a expanded version of the St. Jude Hospital in the South. The only thing that we found was the recommendation that we should increase the NIC contribution, which is currently 10%. So it means for all those people who are working and are paying their NIC contribution, that their contribution on a monthly basis would increase by 50%. So they would now, instead of paying 5%, they would be paying 7.5%, and the employers who are now paying 5% would also pay 7.5%. And it was projected that that would generate about $55 million a year. And that would potentially cover the additional cost of operations of both OKU and hopefully of St. Jude's. When my cabinet reviewed that as a policy, we didn't support it. And the reason why we didn't support it is while we would have raised the money through additional taxation to be able to cover the cost of OKU, the people who could not afford health care today under that new regime would not be able to afford health care. So only the people who could afford health care would benefit. In fact, we envisioned that there were people who were workers who would actually be contributing to the additional operation costs through their NIC contribution, but they themselves would not be able to afford to go to these entities. So my government looked at the possibility of introducing a national health care insurance. And that we were saying that every single St. Lucian needs to have health care insurance. So those people who are working would, like an NIC contribution, make a partial contribution with the employer. So collectively, they would meet that contribution. The government would now pay for the insurance premiums for the people who are vulnerable in our society, those people who are living below or equal to the poverty, those people who are unemployed, the elderly who don't have an opportunity of being able to make any additional monies. So if we were able to do that and 100% of the people were insured, we felt that this would be a more equitable way. So as we now worked on improving the quality of health care, the more important aspect of it is that all St. Lucians would have access to it. So we define poverty in this country as somebody who's earning 6,000 EC dollars a year or less. How is it that somebody who is living on that kind of resources could ever access health care? But if now that they have their own insurance card and they're able now to pick and choose where they want to go, and it's a simple question that I ask St. Lucians to ask of themselves. If in fact the cost of health care was not the issue, would you go to Victoria or would you go to Tapio? Wouldn't you all want to go to a quality facility like a Tapio? We also recognize that if we want to improve people's health, it means that people must be able to afford to go to doctors earlier. It's much better for all of us, including citizens of this country, if in fact they're diagnosed with potential diabetes before it gets to the point that they have to go on dialysis. We want to be able to diagnose people with cancer when they can take remedies that don't include operations or dealing with a life and death situation. So the longer you wait, the more expensive the health care becomes, but more importantly, is the greater risk people are at. So we know that there's a direct correlation between early access to health care and people's longevity. So healthcare insurance will provide that opportunity. So the next question that we're trying to decide is, once we now know we have healthcare insurance, and government is working on mechanisms to be able to afford for this system to work, becomes now our focus on quality of the healthcare. So clearly, in being able to open up OKU, now that everybody who's using the facilities are insured and it creates a revenue stream, we believe that that's a first step in the right direction. We're now looking at several different options on how we're going to operate OKU. We can operate it exactly like we're operating Victoria or St. Jude's, in which the board is entirely government and it depends exclusively on the resources of the state. Or we can look at a management contract. In fact, there is a long list of people who are prepared to offer their management services for OKU, but that is going to be still at the expense of government. And we're looking at the possibility of a joint venture partner. Somebody who's prepared to come in, operate OKU, make an investment in OKU, and help broaden the services that they're able to provide. Because what we've recognized is that the additional revenue stream that we can bring to the table is medical tourism. And for us, medical tourism is the OECS, Barbados, Trinidad, and Guyana. If we get people coming out from Canada or from the United States of America or from Europe, that's only an added benefit. But if we're now able to provide the quality services that can compete with health services in this region and get people to use our services, the benefit to Saint Lucians is that we help subsidize our cost, but more importantly, more than likely, we're going to broaden the quality and level of services that we're going to be able to provide. So it means that many Saint Lucians who are currently having to travel abroad to get healthcare services will be able to more than likely get those services right here in Saint Lucia. So this is where we are. Decisions that we still have to make is, one, once we move into OKU, are we going to do it as a management contract, or are we going to look for a JV partner? And we are in advanced discussions with a potential JV partner, but we have kept the door open for anybody else we can bring to the table. The second big decision we have to make is what we're going to do with St. Jude's. So this has been a vexing issue for some time. When we came into office and we realized that OKU was not going to open up in December, and when we realized the amount of money it was going to take in order to open up the St. Jude's, we commissioned a study. The first study was to determine what was spent and how much more work did we have to do. That initial study showed that we had spent approximately $80 million and that we had about $20 or $30 million in outstanding payments. We then commissioned a study to make a determination how much it was going to cost for us to be able to complete St. Jude's. And it's at that point we realized that not only was it going to take over $100 million more in order to complete St. Jude, but the facility would not be of international standards. And this is where I beg St. Lucians' patience and indulgence. If you look at OKEU, it cost $168 million fully completed. meaning the building that you see, all of the equipment, everything, $168 million for a 136-bed operation. We also know that there were cost overruns on that project. Meanwhile, St. Jude's has cost us so far in excess of $118 million, and we're only 50% completed. But more importantly, if you physically look at the building at OKU and compare it to the building at St. Jude's, there is a dramatic difference between the two. And there's no way that you can ever say that St. Jude's current structure is of equal standard to OKU. Yet, if we continue down the path we're going, St. Jude is going to cost substantially more money than what OKU did. It would have been easy for the people who were doing St. Jude's, if they knew better, to have simply gone up to Castries to look at that structure. But the fact is they didn't. And they didn't because there was never a plan as to what was going to happen. Meanwhile, the poor staff at the George Odlum Stadium, who my heart goes out to, and I think that all St. Lucians, and particularly the citizens in the South, owe the hugest debt of gratitude for what they have put up with. But what has made it worse is every year they were being promised that next month, in a couple of months, we're going to be moving into the new facility. And that day never came. So when we came in and we've not been able to pronounce exactly where we're going, and we've put a halt to the development, that was a further heartbreak for those staff members. And I want to let them know that we're on their side. And that's why we have begun to do work to fix up the George Odlum Stadium. Not with the idea of them staying there permanently. But we've recognized, regardless of what decision that we make at St. Jude, it is going to take time to resolve that problem. And so we either have two choices. Put in a temporary facility, which my government had looked at very early, and I was discouraged in doing so, or fix up the facility. Hopefully we can get out of there within the shortest time possible. So the decision that we've now made is we're going to build a new wing utilizing the core facilities of the St. Jude's location. We know that there are water tanks, there's a sewage system, there is a dialysis lab, there is an administrative block, and there is a morgue. So we believe that that is sufficient amount of infrastructure of money which we would not have to spend. And here's unfortunately another sad reality. That a lot of equipment had actually been purchased and arrived in St. Lucia because there was always the expectation that we were opening the facility very soon. And that equipment stayed for years in containers. Millions and millions of dollars of equipment. What has happened? That equipment, the warranties, has expired and we cannot use it. So we now have to spend millions of dollars to replace equipment that was not there. The vexing thing for me and the vexing thing for you, so that if there was in fact anybody who cared and understood and was honest with themselves that the facility was not going to open, could have easily allowed that equipment to go to healthcare centers, or to have gone to Victoria Hospital, or even to the same OKEU. Or they could have given it to Tapia, even if they sold it or gave it for free, but at least it would have gone to the benefit to St. Lucians. But that didn't happen. So now we're going to have to find more money to buy equipment that we already had bought. But there are some pieces of equipment in which it was ordered and paid but not delivered. So it means we have the opportunity, once we build this new facility, to put some equipment in which has already been prepaid. So this is the direction we're going to go in. We're going to build a new wing, and it's going to take us approximately 18 months. Once we've moved into the new facility, the staff from the George Odlum Stadium would be moved in there. We have organized several sources of funding. Part of it would be the $10 million loan that we received from the Taiwanese, and we're going to be able to do it through a bolt arrangement for the remaining amount of the money. Once we've moved into the new facility, the staff from the George Odlum Stadium would be moved in there. So I want to thank everybody for their patience. I know that there is a tremendous amount of misinformation that's taking place, but at the end of the day, we have had to be sure that what we say to St. Lucians is the truth, and that we can give you commitments that we can live with. I think many St. Lucians are tired of hearing that the facilities opening up next year only be disappointed. But I thank you for your patience.
Thank you very much, Honourable Prime Minister, for that introduction to our discussion today. I would now like to bring in Minister Joseph to take us briefly through a chronology of events from when we took office in 2016 with regard to the St. Jude project specifically, because your ministry is charged with the construction of that hospital. So if you could take us through where we started from and where we are today.
Thank you, and good evening to all St. Lucians. It is indeed a saga, if you can call it that, what happened at St. Jude. The situation is one where we've had a lot of discussions, and I may choose not to go into great detail of what has transpired, because I think the Prime Minister has given a very good preamble of what we inherited at St. Jude. But I will say to the people of St. Lucia that we all have a responsibility towards what happens in our country. What happens in the healthcare system affects all of us in one way or the other. And it's on that basis I am saying that we need to be fair in our approach and our discussion to everything that relates to St. Jude. I will say though, the initial project, the conceptual project for St. Jude was never to expand the hospital to that extent when Minister King was Prime Minister. It was purely to refurbish or to repair the burnt wing, and then to refurbish the roof and some of the facilities inside the existing St. Jude building. So when people tell us in St. Lucia, but it operated as a hospital for all of these years, why now it cannot operate? That is where the problem is. The problem was never with the existing buildings of St. Jude, but all of the additions that was made to the St. Jude building. And the focus moved away from repairing the core building, and now you have about 20 satellite buildings around St. Jude, made up of warehouse, chapel, cafeteria, or gift shop. I mean, you name it. If half of the money and time spent on these additional buildings that could have come in at any time during the phase of construction after the core hospital had been completed, then the nurses, doctors, and patients at the stadium would have been moved to the facility years ago. But if you observe what happened at St. Jude, the facility's size was almost doubled. And what is amazing about what happened at St. Jude, it used to be a 110-bed facility. It ended up being an 88-bed facility before the fire because of some reconfigurations. But the new building that is there would not be any more than the 110 beds that St. Jude used to have before there was a fire or the reconfiguration. And then the question remains, why did we spend that substantial amount of money, increase the buildings by 79,000 square feet? So the building is more than double the size that it was. Not the core building facility, but if you take the square footage of every building on the St. Jude site, it would come up to an additional 79,000 square feet with no additional beds for the hospital. So the question is, what were we spending all of this money for? And people have criticized this government for stopping the work to have an inventory of what transpired. And we have been heavily criticized for spending less than $1 million to investigate what happened at St. Jude. But it was only through these investigations we have been able to find equipment and supplies that belong to St. Jude in the tune of millions of dollars. We have also been able to identify several irregularities that transpired, and we were also able to discover that there are major challenges to operating the existing facility as a hospital. One of the key areas is the airflow circulation of the building. And given the problem that we are having with mold throughout buildings in this country, and the possible contamination of the operating theaters and the hospital itself, when you have airflow quality problems, then you know that this is not something that can work well with the hospital. So this is what we inherited. I need to say again to all St. Lucians, there was no plans with planning approval for the hospital. The plans for the approval for St. Jude Hospital was submitted in March of 2016 to the DCA. That is what was submitted. And people usually ask, well, when UWP was in government, why didn't they submit the plans? Because if you're doing less than 10% repairs to any building, you are not required to submit plans. Now, I'm not saying that this is the reason why the plans were not submitted, but at the time when the work commenced, it was in an emergency situation. But 3-4 years down the road, it could no longer be an emergency situation. So this is what we inherited, and that is why the work was halted with the aim. And we have brought in more than a dozen professionals to try and see how we could complete this existing facility as a hospital. And as the Prime Minister indicated, that is why we were able to come up with the formulation of a plan that we are going to utilize some of the existing structures at the facility and build a new wing that would house the operating theaters and the wards and the emergency section, which are the key areas of major problem for us in the existing building.
This is great news that we've come to a decision on the way forward for the St. Jude Hospital. But Minister, you would recall that we also have the hospital now housed at the George Odlum Stadium. We know that your ministry has commenced some remedial works on the grounds. Can you tell us specifically what's going to be done and why?
Presently, we have commissioned works to the tune of about 1.5 million EC dollars on the George Odlum Stadium. The major component of the work has to do with taking down the roof of the stadium, which is posing a threat and danger to the staff and patients at the hospital. Also, now that we are in the hurricane season and we do not know what the season holds for us during this time period, so it is very important that we address that concern so that if there's any problem with a storm, at least we would know there is a certain measure of safety we can count on in terms of loose sheetings from the roof being able to fall over or to cause damage to life and property. Also, for storage facilities, for medical equipment, medical supplies, we have commissioned some works with the placement of 8 containers and a roof over it so that it can be more comfortable for the staff at St. Jude and have it in close proximity. We had the option of using one of the buildings at the free zone, but it would mean additional cost for St. Jude for its operation because of the distance of the free zone to the hospital itself. So we believe that the makeshift facility being put in place there is going to assist St. Jude's in smoother operations and better storage facilities. One of the areas we are trying to address and we have not finalized plans for is that of the sewage problems that exist at St. Jude. And I need to place on record today that according to the information received, that the pumping system for the sewage at the George Odlum Stadium went bad about 6 years ago. And during these 6 years, nothing had been done to address fixing that problem. So you find now the sewage system is backing up over a very short period of time. And what is even more concerning to me is that this raw sewage is going into the mangrove in the area across the highway from St. Jude or from the George Odlum Stadium. And this is a situation that have existed for about 6 years. Now you would recall that this government came into office only 2 years ago. So the question that remains for us to ask is the persons who are in charge of St. Jude and the persons who are so environmentally conscious about what is happening. You know, nobody, you mean no one knew that the sewage system, the pumps were not working? Now we have the burden of trying to fix this problem. And when I try to get a system in, it would be costing millions of dollars to get a mobile system in here to be able to deal with it. So we are trying to design a second septic system to try and accommodate the sewage from the George Odlum Stadium so that we can stop what is happening in the mangrove today. So these are some of the works that are ongoing. There are plans to do some painting and to fix the electricals on the building. And I need to make it clear to St. Lucians that when we carried out the overall estimates for everything that is required at the stadium, it would range between $10 and $12 million. In discussions with the union, with the board of St. Jude, with the maintenance team at St. Jude, we agreed on some of the key areas that needed urgent attention. We gave a commitment that the work would be done, and as I speak to you, work is ongoing on all of the areas that we had agreed that we would address immediately.
Thank you, Minister. Even while the government is trying to work through some of these long-standing issues, the Ministry of Health has been continuously working to better our healthcare system. I would now like to invite Minister Isaac to take us through some of the achievements the ministry has been having so far. Minister Isaac.
The Ministry of Health has continued to provide services, healthcare services, to the people of St. Lucia. As you know, the health of a nation is the wealth of a nation. And therefore, we are very mindful of everything that is happening in the healthcare sector. We have strengthened our healthcare system over the past few years in terms of providing ultrasound machines at Denry Hospital, Grosile Polyclinic, and the Soufre Hospital. And speaking about the Soufre Hospital, that hospital is going to recommence operations by October of this year. It should be fully back in operation. We have improved lab and imaging at the Grosile Polyclinic through the procurement of additional equipment so that we can provide more services at that clinic. We have also extended the hours of the Grosile Polyclinic to midnight every weekday, and we are looking at extending it on opening the polyclinic on holidays up to midnight of every day. We've refurbished the wellness center under the Smart Hospital initiative. We are doing so in the wellness center in Bellevue, Deriso, Mon Repos, and a total of 12 wellness centers will be refurbished under the Smart Wellness Center project. Currently, we have 6 pharmacy technicians who are undergoing training in Jamaica so that we can improve pharmacy services in Region 4 and Region 5. We have also extended pharmacy services at the Grosile Polyclinic for an additional 8 hours a day. Dental services for both adults and children are now offered at the National Mental Wellness Center. We have a dental hygienist who was appointed at the Grosile Polyclinic. All of these are services that were not provided prior to when we came into office. We also have diabetic retinopathy services at the Castries Wellness Center and the Viewfort Wellness Center, so now people do not have to come down to VH or to OKEU to get these services. We have started moving services from Victoria Hospital to OKEU. We've been able to move the dialysis unit, fully move the entire dialysis unit to OKEU, but we have continued the services that were offered at Victoria Hospital. So we have new machines at OKEU, adding 12 machines to what we already offered at Victoria Hospital. And of course, we have one machine, an additional machine on site, just in case we need to bring that one into operation as well. Our physiotherapy department has also moved from Victoria Hospital to the OKEU with, of course, pharmaceuticals. And our medical outpatient unit is the last unit currently to be moved to the OKEU hospital. So as we go on, we are moving one unit at a time as best as possible, because we do not want to move too many things and then, you know, anything go wrong. We have to make sure that everything is in place so that as we move different units, all the supporting services that are required for that move is at the OKEU or is being moved to the OKEU at the same time. We have strengthened our mental wellness services by adding an additional counselor as well as an occupational therapist to our staff complement. We have a child and adolescent unit that has been commissioned at the National Mental Wellness Center. As you know, prior to our coming in office, everybody was kept in the same location. Children were kept together with adults in the Mental Wellness Center. So now what you have is you have a designated child and adolescent unit where the children are kept if they need services at the Wellness Center. We have continued collaborations with external partners such as the World Pediatric Project. And that project, prior to us coming into office, that was offered free of charge to the government and people of Saint Lucia. However, because of abuse that people were abusing the program, when we came on board, we were required to pay for these people who were getting services from the World Pediatric Project. So now what you find is government has allocated a budget towards that project, which is going on very, very well. But prior to now, we had no budget for that project. And of course, we had a lot of issues with that project because of the way that people were abusing it. We have also expanded our mission by the Starkey Herring Foundation, where that foundation has promised to fit every St. Lucian who require a hearing aid with a hearing aid, and they are also providing batteries and supporting apparatus to go with those hearing aids for everybody in St. Lucia that need that service. We have an agreement with the Sick Kids Hospital of Toronto. We have just renewed that agreement, and of course we are going to be providing medical education to clinical officers in St. Lucia through that agreement. Diabetic retinopathy services, including eye laser surgery. We are offering that in collaboration with London School of Hygiene and Tropical Medicine and Vision 2020 links. So we have at the Ministry of Health continued to provide a lot of services. In addition to what we came in and met at the ministry, we have added quite a few more services to what we were offering, what was being offered.
Thank you very much, Minister, for that extensive list of achievements. Prime Minister, I wanted to return to one of the things you mentioned and that has been in the news, the subject of a public-private partnership. The government campaigned on trying to create an integrated healthcare system where you have both the public and the private sector participating. So the government looking at a PPP is not surprising, but I think there have been some fears in the public domain. Recently we heard that the EU actually suggested at the naming ceremony for OKEU that we should consider a private-public partnership. Can you speak to the people of Saint Lucia about why the fear of this type of direction is not necessary?
Well, Nicole, the objective is to be able to provide affordable, quality health care. And that's for all, not for some, not for most, but for all Saint Lucians. And we're attempting to do that in the context of where the country is in a financial mess. We've been running continual deficits, meaning that we're spending more money than we're earning. As a result of it, one of our highest expenditure items is interest payments. It's $170 million a year in interest payments. The next thing is that governments consecutively, not just here in Saint Lucia, are running away from universal health care. So universal health care is where, in essence, the government is funding health care. So what was taking place at Victoria is a classic example, where we were trying to run a hospital on a government operation system. So we're giving a quarterly allocation to the Ministry of Health, who then is passing on the money to Victoria Hospital, as if people get sick in equal quarters. And we can't get enough medicine. So the fact is, we don't have enough dialysis units, we don't have enough defibrillators, we don't have enough ICU tables, we don't have enough medicine, we've not been able to maintain the building because all those things now require a cash flow from the government. That's why I said that St. Jude's is working a bit better because it has its own board. And while it's now almost 100% dependent on the government for its subvention, it at least has an accounting system in where people who are coming in that are covered under insurance is collecting the money. We're not even doing that at Victoria. And so you see things like old pieces of equipment that have not been taken out, basic things that if you were running a business, it wouldn't be there. We have to recognize that for Saint Lucia, and given our size, it's going to be very difficult for us to have a tertiary level healthcare system that can meet all of our needs. We struggle with that. Now, if you take Martinique as an example, the French government, because of its policies, heavily subsidizes the hospitals in Martinique. And therefore, they're able to provide services well beyond what the size of the country, and that's with 400,000 people, far less Saint Lucia with 170,000 people. So the question becomes, how does government fulfill that obligation? How do we make sure that every single Saint Lucian is taken care of? Why should it be that people who are earning incomes below a certain level or who are unfortunate to be vulnerable in our society, for whatever decision, can't afford access to health care? But I also want solutions to also be honest with ourselves. How many people's lives, how many families' lives have been financially ruined because a loved one became sick? And naturally, all of us are going to do the same thing. If your father or your mother or your sister, your brother, or a relative of yours is dying, nobody's going to think about the money. We'll mortgage our home, sell our car, commit the monies we're making, do everything that we can, deplete our savings in order to help that one, help a loved one. So how many people's lives have been ruined because they've been put in the position of having to take care of it themselves, and then resort to being beggars, having to go and ask other family members, other friends, even the government, to be able to give you money to be able to help your loved one. How many cake sales, carnival boats and barbecues and things that we continually do to raise funds? that have been dedicated to be able to make up for the short gap. So we feel the first thing is healthcare insurance. If everybody has healthcare insurance, we're empowering people. We're making sure that they can afford to go, and we fulfilled a critical component. So the second part now becomes, how do we provide quality healthcare in St. Lucia? And we're saying, the numbers clearly show that even if we have healthcare insurance, it's not going to generate enough revenue to be able to cover the cost of operating the hospital as well as our primary healthcare services. So something is going to have to give. So the question becomes, can we provide a high enough quality service that allows people to come here? If we're supposed to do it in the means of government, it means that government would have to make the investment, the capital investment for new equipment and broaden the level of services that we're going to have. Now, there was a recent article on Harvard Review which looked at Cayman Health City and said, wow, there's a lot to learn from what these people are doing. So the benefit that Cayman Health City has is that they're affiliated to over 40 other hospitals in India. And the back of the house operations are being supported in the facility. So it's almost like your hospital is part of a broader network in which the economies of scale of purchasing medicine, which we're trying to do at the OECS level, and we're struggling with. But the fact is, even buying enough medicine within the OECS level has dramatically reduced the cost of medicine to us. Imagine if we were part of a bigger network, purchasing even more medicine and reducing that cost. So by bringing in a joint venture partner, we can do that. Now, I want to separate management contract from joint venture partner. A management contract is an entity that's bringing their expertise to the table that we're paying for. So we're continuing to supervise their work, we're depending on their expertise, but the fact is, ultimately, at the end of the day, the balance sheet, profit and loss, is carried by government. Whereas if you do a JV, you have the opportunity of getting another entity to put their money into the table, and that they can now are incentivized and motivated to do things more profitably to help themselves. We would love the opportunity where our local doctors could participate in an equitable basis. Those are all the models we're looking at. In fact, we just recently had an expert that came in to review government's policies, and he was able to give us some really good advice on the introduction and the management of our healthcare insurance. But more importantly, how do we create this public sector, private sector partnership that's not necessarily exclusive to one entity, but it would be available to multiple entities in order that our medical fraternity here could feel that this is not in any way threatening them. That is who we have to be able to work with. Our government has said repeatedly, we're open to discussions. We had a meeting with the Medical and Dental Association. The first meeting we had was about 4 hours, maybe a little bit more than 4 hours. We then had a second meeting with the executive of the Medical and Dental Association, with the other unions and themselves, which lasted also another 4 hours. And I also had the opportunity of meeting doctors one-on-one, as well as a group of doctors, and talking about where we're going. And I would say too that we're very close. I mean, I was very happy to hear the Medical and Dental Association recently pronounce that they're supporting the healthcare insurance. Mm-hmm. So, look, we all agree that we should statutize OKU. We now all agree that we have to have health insurance. The next step is, how are we going to manage the facilities we have? And what's going to resound to both the benefit, more importantly, of the people, but it has to be sustainable, which means it has to be economically viable. I want to say to solutions that as long as we continue to look at health, education, and security exclusively as social programs, we're not going to make the right decisions. There is a huge benefit by having a world-class healthcare system in Saint Lucia. Clearly for solutions themselves, that every solution now will have access to healthcare when they need it. Two, that there's going to be an increased opportunity where Saint Lucians have had to travel in the past, that now they don't have to pay for the airfare, they don't have to get a visa, they don't have to stay with family and friends, or don't have to find money to live abroad. They can actually be here while they're getting their operation or getting chemotherapy or anything else. That's a massive benefit. The next benefit that we're getting is that us trying to attract people who live elsewhere to think of Saint Lucia as a secondary home market improves significantly when those people know that we have quality health care. When they know that if something goes wrong with them, that they're here. We have amended our International Business Corporation Act to allow companies to open up their headquarters. They're transferring skilled people to be here. And I can say to you that it's going to make our job substantially easier when people know that that quality of health care is available in Saint Lucia. So that's when I say it's an economic opportunity as well, that's huge. And this is what we've been discussing with the Medical and Dental Association. So we're hoping that through dialogue and our commitment, and to never lose sight of who this is supposed to be for, this is about the people. But more important, this is about the more vulnerable people in our society who have been deprived for years, have not had that access. This is for the families who have lost money and now will no longer have to confront those decisions. This is about putting Saint Lucia on a world level. This is immediately improving the quality of life of Saint Lucians, that they're going to have access to health care. So I want to say that we have looked at this from every single way. At no point has my government complained. So when we bring up the issues as to what took place in the past, it's not to complain. It's basically to say, here's factually what took place, and that we're going to fix it. We're not going to back down from that. We must open up the hospital in the south. That's never been at play. The question is, how can we do it to make sure that we do it in keeping best practices, that we provide a quality facility, and we don't cut any corners, and we do it in a way that we can afford to do it. But we have to take all those things into consideration before we do it. If you don't, what has happened at St. Jude is exactly what happened to us. You can't just go there with the commitment. Your commitment alone is not going to resolve this issue. But I just want to say to all our partners that my government will continue having dialogue, we will continue discussing with everyone, and we're going to make sure collectively we can come to the best decision for all of St. Lucia.
There have been some concerns, Honourable Prime Minister, by employees within the health sector as it relates to the PPP. Can you speak to employees specifically at Victoria Hospital in terms of the transition and how it would all work and whether their jobs are secure?
So again, as I said, the decision to create Millennium Heights and to statutize OKU was already made. So everybody who is currently working at Victoria Hospital will be interviewed to be able to get employed at OKU. If they're accepted, then they would be retired from the government, they would be paid off, and then now they would have a new engagement with Millennium Heights. If in fact that you're working with government and you're at Victoria, and there's not a job for you at Victoria, we're going to find a job for you somewhere else. Nobody is going to be expected to make a sacrifice for the state. So once you're a full-time employee of the government, which is what you are when you're working at Victoria, and if in fact we can't find a job for what you're currently doing, we will help you and pay for you to be able to become re-educated to find a job elsewhere within government. But nobody is going to lose their job. In fact, if some people are saying, I don't want to go to the Millennium Heights and I don't want to work for the statutized agency, they're free to do that. And it will be government's responsibility to find them a job elsewhere. We've taken all of those things into consideration. We're going to work with you and make that work. And that applies to everybody who's involved in the healthcare sector.
Is there anything you can tell us specifically? I'm not sure, Minister of Health, if you want to come in on this one with relation to national health insurance and where we are at right now.
We've had discussions with PAHO as well as the EU. What's great is healthcare insurance is not new to St. Lucia. So, many people have healthcare insurance. All the institutions are accustomed to filling out the forms and getting the reimbursements. We are continuing to work with consultants on moving forward. The Chamber of Commerce and Manufacturing Association, as well as the Hotels Association, have asked us for a white paper. We've promised to get them the white paper by September of this year, which will lay out where we're going to be going. The goal is to have all final decisions made by the end of this year. So how it's going to be structured, what's going to be the architecture of all the organizations. So what we've seen elsewhere in the world is that to keep healthcare insurance costs down, that we must have fixed prices on services. So exactly how you have a NERC for utility companies, that all the prices have to be agreed to if there's any increases, is the same thing we're proposing to do in healthcare. We're also talking about having now a national health care authority, and that entity will now certify all of the facilities in healthcare, including the hospitals, and also review cases so that we are monitoring how doctors are prescribing and how the system is working to make sure that there's no abuses, so from a regulatory perspective. Once we've worked out the architecture as to how that's going to be, then between the months of January and June, we'll be now doing all the legal drafting, getting the drafts out, allowing everybody to review them. But the goal would be that by sometime in the summer next year, to go to Parliament and pass all the necessary legislation. We would then hope to have now insurance policies implemented by no later than the end of that year. So by the end of 2019, everybody will be insured. Now, why is that important? It's important because, as Mary said, we're moving into OKEU. And I've said to you that the cost of being an OKU is going to increase the operating cost or the expenditure of government by 70 million. So while we're moving in there under this current regime, government is the one who's carrying that. And those are revenues that we have to find from somewhere in order to be able to pay. The Medical and Dental Association, as an example, had made the recommendation that we should bring the VAT rate back up to 15%. They've said that we should go ahead and increase the NIC contribution from 10% to 15%. Also, they were suggesting, I think, that we consider taxing tobacco and liquor as well as a sin tax on sugar. The problem is we've seen that when you increase taxation in this country, it doesn't necessarily mean that you're going to get the revenue. Right? We've lowered the VAT rate, which is a policy of my government. If you start taxing the economy again, there's a better possibility you're actually going to earn less money than you currently are now. So our government does not believe in increasing taxation. So our government believes that sharing that responsibility and creating a JV is a better way to go. So using the government's revenue as support, reducing the overall risk, that government becomes a regulator, and empowering the individuals by giving them healthcare insurance is a much better way to go because it becomes shared from that perspective. So we're going to continue to move down that road. We've also just met a new consultant who actually helped BVI and some of the other countries in the world and Europe. He is a Grenadian by birth. He's a neurologist. And I have to say to you, has tremendous amount of experience in putting these systems together. So he is helping us prepare the white paper. And he's brought up some very interesting ways in order to be able to introduce the healthcare insurance. And what I think that we were all encouraged by was his commitment to participation. And so I just want to say that the reaction that we've seen, for the most part, is normal.
Yeah.
But my government is committed to improving the welfare of everybody in this country. There are difficult choices to be made, but we're prepared to take the political heat and to make the decisions that we believe that everybody is going to benefit from. That doesn't mean that we're going to just ignore people who are not in support of what we're doing. We're going to listen, but at some point we have to make a decision and to be able to move on. And I'm really hoping that we'll continue having that dialogue. Everybody has to buy into this. There's sacrifices that all of us have to make. But we have to accept one thing. What we are doing now is not working. It's not even close to working. When you go to St. Jude, when you go to Victoria, how can we say that this is the standard that we strive for? And that's why I made the comment I made. If in fact you had access to healthcare on an equitable basis today, and you were given the choice between if you want to go to Victoria Hospital or you want to go to Tapion, which one would you choose? Which one would you choose? And I'm very appreciative of what's achieved at Tapion, but I think even the doctors at Tapion know that that's just the beginning. We need to raise that standard if we're going to be competitive in the world today. So,
Thank you, Prime Minister. Minister Isaac, I know you wanted to comment on the National Health Insurance.
I want to say that the Ministry of Education will be conducting an education drive in terms of consulting with all the different stakeholders, the Chamber of Commerce, the nurses, doctors, go to the schools and explain this, because the people have to understand what National Health Insurance is all about. And I don't think that a lot of people really understand how it is going to benefit them. That we are saying everybody in this country is going to have national health care. They will be able to walk into a doctor's office and do their necessary tests before they get sick. They will be able to keep checks on their on hypertension, on high blood pressure, on their cholesterol level, doing all these preliminary tests that you need to ensure that you do not get sick. Things you need to know before you get sick. Indicators that will tell you if you are going to get sick. Usually what we find is people come to us when it's too late. They are already sick, they need to be hospitalized, and that puts a lot of pressure on the system. That puts a lot of pressure on Victoria Hospital and so on. And sometimes people do not understand the rationale behind building a big hospital that has less room, less bed space. And that is what was behind building having less beds in the OKEU. Because what we are hoping is that if we have a very strong primary health system, and right now we are strengthening our primary health care system, with that healthcare system, with that strengthened primary healthcare system, it is going to redound to us having less cases, less people needing to go to a hospital, because we are going to have less people who are so sick that they need to go to a hospital. So people have to think of that when they hear National Health Insurance. Everybody will be able to walk into a doctor's office, do the necessary checks without them having to worry about where the money is coming from, because government is going to be taking care of that, and the other agencies that we are going to bring on board to ensure that people get proper health care before it is too late, before they are dying. At that point, a lot of the people, we cannot help them, and we are losing a lot of people in Saint Lucia. A lot of people are dying in Saint Lucia because by the time they get into the healthcare system, it is too late. And that is simply because many people cannot afford to go and see a doctor when they have a headache, when they have the small issues. And if they come to us before these issues multiply into bigger issues, then we can help them and we can be saving more lives. So this national healthcare insurance that you are hearing people are talking about, it is really something we are trying to do in your own best interest, especially for the poor people of Saint Lucia, the people who cannot afford to go and pay to go to Martinique, pay to go to the States, pay to go to Cuba, and so on and so forth. So it is something that you have to try and understand, try and see how you can contribute to that. And the way you can contribute as a citizen of this country is to get the necessary education to understand it and to embrace it. I also want to say that we are going to be looking at a package of goods. These goods will be priced, and maybe sometimes that is why you get in the negative backlash from some medical practitioners in Saint Lucia. Because right now, personally, I believe a lot of the services that we get from some of our medical practitioners, these services are priced out of pocket. Many people, myself, cannot afford some of these services in Saint Lucia. I go to Martinique and I get cheaper services. I can pay my transportation, go to Martinique, do certain medical procedures, and come back here, and it is cheaper than me getting that service here. So that package of goods is going to be priced, and doctors will not be able to charge different prices for the same thing. If you have a finger that needs to be amputated, it's going to be one price. So doctors that really care about people in Saint Lucia, doctors that are really interested in health care to create a healthier nation, they are going to embrace that sort of uniformity, that sort of package that we are bringing forward. And I know, I have spoken to many of these doctors, they are looking forward to that because they know oftentimes they have to give free health care to certain people because these people, and the people cannot follow through because they have no money. So we have to start embracing the whole idea of national health insurance, looking at standardizing the cost of healthcare in Saint Lucia. That is also going, if we are able to statutarize our tertiary care institutions, that is also going to leave the Ministry of Health free to be the regulator in our medical care system. And that, we believe, is absolutely necessary because right now, we are regulating ourselves. And as you know, an agency cannot regulate itself. So by removing the responsibility of tertiary care from the Ministry of Health, we will be creating a stronger healthcare system. And the Prime Minister has already spoken about the network, the people from the network that we met. The gentleman is a neurologist from the University Hospital of Miami, and they're on a network that is the Jeffa network. I know that the medical practitioners at the Tapia Hospital and some other medical practitioners in Saint Lucia, they are very familiar with that network. They work with that network. Some of them are part of that network, and we are going to be hearing from this gentleman. He will be assisting us to see how best we can establish the national health insurance plan that we are looking at for our people in Saint Lucia.
Not to put you on the spot, Minister or Prime Minister, but I was just wondering, do we yet have an idea of the coverage that we're looking at for each Saint Lucian? And what about persons who are unemployed? Can we get some idea of how that will work?
We're looking at the different systems. We've had 2 proposals from insurance companies, and what they're offering is very affordable, and it's certainly going to improve people's lives significantly. And that's with no negotiations. So the doctor that we met with gave us other models of where instead of maybe government providing the healthcare insurance only for the vulnerable and the civil servants, that we actually, government provides a base insurance for everyone. So it means that we have a homogeneous system, and then we have additional pieces that can be added that suit your lifestyle, right? So the way that the system would work is if you are employed, then you will be making a contribution to your healthcare insurance, and your employer will. What that split is can be anywhere from 60-40, meaning the employer pays 60, you pay 40, to 50-50, in that range. Same thing if you're a government worker. If you are unemployed and you were working, you're making a salary below a certain amount, which means that you wouldn't have any savings. While you remain unemployed, government will continue to pay that policy for you. If you are considered to be a vulnerable person in society, earning a national income, an annual income of less than a certain amount, government's going to pay you. Not just for you, for your whole family. And for the elderly who have no ability of increasing their incomes, once they're earning a pension below a certain amount, government will also pay.
Okay.
Right? So it's not about people who can't afford it not being able to participate. Everybody must participate. Everybody will be getting the same quality level of insurance. So there's a basic amount. Now, if somebody wants to buy above and beyond the amount that we're providing, they're free to do so. And we're making sure that we design a system that does not in any way displace any of the health insurance providers. That's either the brokers or the insurance companies themselves. So he was able to bring some new ideas to us, because originally we were looking at maybe government would have one provider. But I think that the mechanism that he was proposing to us would be much better, and that's where the dialogue is coming through. So I just want to reiterate a couple things. One, we've made a decision to make OKU a statutized body, which is called Millennium Heights. That decision is made. We've made the decision that we want a national health care insurance. What we're doing is deciding how that's going to be structured. We hope to have, by September, that completed. We hope between September and the end of the year that we would have formalized what the structure is going to be. And all along with dialogue with the unions, dialogue with the medical practitioners, and dialogue with the people. Once we've now gotten to the end of the year and we've finalized what that structure is, it's now to be able to put the legislation in to support that. And then looking for the implementation, and as Mary said, to be able to continue to inform people as to what that is. I just want to, at this point, say a big thank you to the Honourable Minister Guy Joseph for the incredible leadership that he has shown. And I know it's not easy. And I know that he's been accused of all kinds of things. But he is a champion of businesses in St. Lucia. And so the work that he's been doing has been amazing. And the commitment, the amount of trips he's made down there personally, and to make sure that we know where we're going. And so I'm very comforted in his leadership, as well as the work that his ministry has been doing. Because they're the ones who have to account to everybody they've borrowed money from. So everybody asks, why is the Minister of Economic Development involved here? He's involved because it is donor agencies' monies that have been used thus far to make this happen. This is who the ministry that was leading the charge previously, so we can't just back away from that. He is the one in responsible interacting with the EU. So all the consultancies we're getting, everything has been coming through his ministry, so it's incredibly important that he be up to date on what's going on. Secondly, I want to thank Minister Isaac and her ministry. And I think that, I remember when we had the fire down at Soufrière, and I thought that I would have been the first minister there, because I had the opportunity. I was at a function. I immediately called up the Marine Police, and the Marine Police brought me down to Soufrière. And everybody who knows the Marine Police boat, it's very, very fast. And I got down there to only find that Mary was already there, okay? Working with her nurses, working with her staff, and even while it was still smoking, we're already figuring out what they were going to do. And the measures that they did in terms of solving that problem in Soufrière, I think are commendable, but tells you the level of passion that she's bringing to the table. So when I appointed her as the Minister of Health, I remember saying to her, and she said, PM, why would you make me the Minister of Health? And I said, it's because of your empathy and your compassion. That is what's required to make this work. So when you can empathize with the people that are suffering on the ground, when you can empathize with the workers, that is going to lead you to the better decisions. And I mean, the Ministry of Health has really been a baptismal by fire since she's gotten in. There's so many areas in which we've had confrontation. And even this issue of moving into OKU, we were repeatedly told that we could not open the dialysis center, that we had to open the hospital in full in order to make that happen. And being told that it wasn't ready. The room was ready. The only thing that was missing were the chairs. And now we discover that there were chairs in containers at St. Jude's that could have easily been moved up there. And exactly what we have done, which is to have opened up the 11 additional dialysis tables, as well as keeping Victoria Hospital going, that could have been done earlier. And she said, PM, leave it to me. And she made it happen. Okay? And she worked with the staff and got it to open. There is no easy solution to these problems. And I want to say that I am very encouraged and I'm very proud of these two ministers and their staff and the work that they've done. And I think the solutions should also be very, very proud of what's going on.
I want to just ask our ministers to summarize as we wrap up in terms of their roles in our system of healthcare and getting to where we need to go. Minister for Economic Development, we know the Prime Minister, we've committed to just about 18 months for the hospital in the south. Anything else from your ministry perspective? I know you're working on some polyclinics as well. Can you just give us 5 minutes? Just summarize, please.
Okay. Yeah, we are targeting 18 months, but that would be 18 months from commencement date of construction for St. Jude, which we are hoping will be in the coming months, way before this year end, that construction should begin down there. Dennery Polyclinic, I had a very interesting meeting yesterday. I had to bring in the entire team responsible for that construction activity, and the news is not good, I may tell you. I was alarmed at what I inherited again. In fact, I actually had to ask the meeting, when the consultant tell me, if you do not address these matters quickly, it will become a Saint-Julie. So just as we have a St. Jude and it's in Bois-Joli, so it will become a Saint-Julie. And I hope St. Lucians understand what this means. But I met with the Ministry of Infrastructure and I put my team together at the Ministry of Economic Development. And I am going to come with you, Nicole, on a special program to give a full update on this. For Soufrière Hospital, we have identified the lands for this new facility. We have almost completed the process of negotiations for the purchase of this land, and it is in a very good location away from the immediate floodplain in Soufrière. So we are very comfortable with the site that is identified. And what we have done is to reprioritize some of the funds that we had on the DVRP to go towards funding part of the Soufrière Hospital in the process. The Mikud Health Center, we have finalized the issues with the location for the new health center in Mikud, and also the drawings are being completed as we speak. So I would expect that it would be able to go out to tender very soon. There is quite a lot happening, and there's quite a bit of interlock with my ministry along with infrastructure, education, health. Throughout all of these processes, we are handling the project, and as a result, it's a joint effort across ministries. So rest assured that you would be seeing a lot more of us from the Ministry of Economic Development as we would plan and execute these projects. I want to leave St. Lucians with the assurance that this is a government that is determined to deliver on the best quality that we promised the people during the campaign. I am very confident about the leadership of this government in the person of Prime Minister Allen Chastanet, and as you would have listened to him today, I am sure you can conclude that this is not the norm for leadership in this country, as we have seen over the years, that he is thinking outside the box, that he is going for new initiatives, and he is telling it to St. Lucians as it is. And in reality, That is what I believe we need as a country, and that is why I'm very confident that we are moving in the right direction. And while we are here discussing healthcare, healthcare cannot do well if we do not have the resources to invest in it. And the performance of this economy under the leadership of Prime Minister Allen Chastanet is testament to what this government is doing. And if we can continue to grow this economy, as we have seen the growth of 3% in this last financial year, then this can only mean better for the health sector and for moving forward. So I am very happy to be part of the team that is working to accomplish the things that we promise the people of this country.
Thank you, Minister. Minister Isaac, can you just give us a synopsis?
We are going to continue at the Ministry of Health. Of course, all the workers who have supported me so well. My team at the Ministry of Health is going to continue to strengthen primary care. We have just received a $20 million grant from the World Bank to strengthen our primary health care. So we are going to continue to work in that area. Minister Joseph did not report on the ancillary hospital, on the ancillary wellness center. So let me say that the funds have been identified, they have been secured, and NIPRO should be commencing that project anytime now. So that one is also in the bag, so to speak. OKEU, of course, we have already put the board in place. So we are going to continue the move into OKEU, and that has already been statutarized, because it is going to, the board is in place and it will be run by the board as of now moving forward. Victoria Hospital is supposed to become a polyclinic, in case people are wondering what is going to become of Victoria Hospital. Hopefully we will be able to move all the other supporting services, the Ministry of Health, up to that facility, because it is such a huge facility. And I say hopefully we should be able to do that, because it is something that I personally look forward to, getting out of the government buildings and moving on to the Victoria Hospital site. And of course we are looking to decentralize mental wellness. This is a very sore point for us, where you have people who are ill and it's almost as though they are incarcerated. You cannot incarcerate sick people. So therefore, we are looking to make mental health a community service, but of course that is maybe in the more medium term. But these are some of the projects that we are currently working on at the Ministry of Health. And I tell you, we have a very, very dedicated team of workers at the Ministry of Health. I believe almost every week you see something unrolling, part of Ministry of Health's program in the media. So I want to take this opportunity to thank my workers and to applaud them for all the work that they have done. From the time I came on board, I know that they have put their best foot forward, and they have really worked very hard to ensure that this government accomplish the task that we have to accomplish to bring better health care to the people of Saint Lucia. I know that my Prime Minister, Minister for Economic Development, these two ministers whom I have to work with very, very, very closely, of course the Prime Minister responsible for finance, and Minister Guy Joseph responsible for the infrastructure for the healthcare sector. I know that these ministers are giving me all the support that I need, and they are very, very enthusiastic. My Prime Minister is totally devoted to ensuring that our healthcare sector becomes much better than it is right now. He sympathizes with the people who are sick, the people whom we can just scratch a little bit of money to assist them with. And I know that he's devoted and dedicated to ensuring that all our people are taken care of health-wise.
Thank you very much, Minister Isaac. And Mr. Prime Minister, you have the last word to the people of Saint Lucia on healthcare.
I just want to again thank the people of Saint Lucia for the opportunity that they've given us to govern this country. It is a responsibility that we take extremely seriously. In building up to the elections, we talked about building a new Saint Lucia, because there were many of the services that we're providing that were not working. But we are committed to making the necessary changes and improving the quality of people's lives. When I go around this country, and I see the quality of life that many people are having to endure, we have got to change the way that we do business. The idea that we can subsidize the price of rice, flour, and sugar, as an example, and somehow that's going to help a poor person, a person now that we know that's making less than 6,000 EC dollars a year, then we're fooling ourselves. Or that we're going to help them by reducing the VAT rate on food items. It's not going to work. And so we're very committed to making sure that when it comes to food, that we're going to make more food available on a consistent basis to those households. That we're going to look at improving the quality of housing that those people have. And now that we're going to empower them by letting them have access to world-class healthcare. They all deserve it. We all deserve it. And I think that all Saint Lucians, the ones who can afford, the ones who are struggling to pay, are going to be happy knowing that our brothers, our sisters, our neighbors, everybody is raising their quality of living. Healthcare is one of those key components. We've said affordable quality healthcare for all Saint Lucians. A globally competitive education. Important. Security and economic opportunity. Because we can't forget about growing our economy at the same time in order to be able to pay for these services. So these things cannot happen overnight. There is no magic wand. There are some tough decisions that have to be made, but it takes dialogue. And through dialogue, sometimes there are people who take longer to understand, and it's reasonable, but it takes time. What we've inherited has been a mess. The state of St. Jude, the state of the judicial system, the state of our security system, the state of the infrastructure in this country, the lack of decisions that were made, the state of the economy, all those things lead to people who failed. We are picking up the pieces and getting on with the job that we have. And I assure St. Lucians that we will make their lives better, that we will improve the quality of life in St. Lucia for all St. Lucians, and we will do it in a sustainable way. So again, for many of you who see me on the street and hug me, and the prayers that you're giving me, because without the Lord's support, there's no way I could get up every morning. He is so important to me, and your prayers for me and my government are so much appreciated. And be assured of our commitment to delivering to you, the people of Saint Lucia.
Thank you very much to the panel this evening. Thank you very much, Minister Joseph. Thank you, Minister Isaac. Thank you very much, Honourable Prime Minister. And thank you to all Saint Lucians who are watching us right now for joining us for this special update on the healthcare system. Good night.